Okay, let's unpack this. Diabetes, it's a truly significant and, well, growing global health challenge, isn't it?
Yeah.
Affecting hundreds of millions. It really demands innovative solutions, especially for catching it early. And here's where it gets exciting, I think. We're sort of stepping into this new frontier using technology, specifically machine learning, to tackle this head on, really focusing on that early detection piece.
Exactly. And what's fascinating here for this deep dive is that we're looking at a recent research paper. It investigates applying machine learning to electronic health records, EHRs. These algorithms, they can process just vast amounts of patient data, spotting patterns that honestly might be invisible to the human eye.
Right. So our mission today is to really dig into this study, pull out the most important insights about predicting diabetes, maybe with surprising accuracy, and then explore what it could actually mean for you and, the future of healthcare. So let's get into the study's approach first. They used a really massive data set, didn't they?
Oh yeah, huge. 100,000 electronic health records. This came from the U.S. Center for Disease Control. And they looked at 9 key variables.
Things like age, gender, BMI.
Right. Hypertension, heart disease, smoking history, and then those crucial clinical markers, HbA1c levels.
That's the average blood sugar over a few months.
Exactly, and also immediate blood glucose levels. So a good mix of factors. And the core of the research was investigating 3 specific supervised machine learning algorithms.
Okay.
Logistic regression, random forest, and k-nearest neighbors, which people usually just call KNN. The idea was to develop predictive models. And supervised learning in this context just means the algorithms learn from data we already have. Patients already labeled as diabetic or not diabetic.
Okay. So it learns from examples to make predictions about new cases.
Precisely. It learns the patterns to then predict for unseen patients.
So out of those 3,
Yeah.
logistic regression, random forest, KNN, did one stand out? What did they find?
They did. The KNN model, k-nearest neighbors, it really emerged as the clear top performer.
How good are we talking?
Well, get this. 96.09% accuracy.
Wow, 96%. That's really interesting. So what makes KNN specifically so good here? Why did it work so well?
Yeah, it's impressive. That high accuracy isn't just a number, though. KNN really excelled because it was so good at distinguishing between the diabetic and non-diabetic patients. Its sensitivity was super high, 98.54%.
Meaning it's great at finding the people who do have diabetes.
Exactly. Crucial for catching it early. And importantly, its specificity was also high, 93.63%, meaning it's also really good at correctly identifying those without the disease.
Okay, so fewer false alarms, which is also really important.
Definitely. It makes it a potentially very powerful tool for screening, maybe changing how we approach diagnosis clinically.
That level of accuracy really does make you think about, well, truly proactive healthcare, doesn't it? But okay, beyond just how well KNN did, what about the factors it used? What did the study show were the most important things for predicting diabetes?
Right, that's key. It's not just that it works, but why. And what they found confirms some things we already suspected, but with data. Older age groups showed a significantly higher prevalence. The average age for diabetics in the data was almost 83 years.
83, wow. Compared to
about 61.5 for non-diabetics.
Okay.
A big difference.
Okay. And if we connect that to the bigger picture, what else? Gender, BMI?
Interestingly, gender did not seem to significantly influence the risk in this data set. So the model wasn't showing a gender bias.
That's good to know.
Yeah. But age did show the strongest correlation with BMI, body mass index. Older people tended to have higher BMIs.
So those factors are interconnected.
They are, and then they use something called SHAP analysis.
Right, that's like looking inside the AI's brain.
Sort of, yeah. It helps understand why the model makes a certain prediction. And it showed that age had the greatest positive impact, meaning older age strongly pushed the prediction towards diabetes.
Okay, that makes sense based on the age difference you mentioned.
And on the flip side, a healthy HbA1c level had the most substantial negative influence.
Meaning a good HbA1c score strongly pushed the prediction away from diabetes.
Exactly. It significantly reduced the likelihood. And this is great because it validates what doctors already know, building trust in the model.
So what does this all mean then? When we put it all together, it seems pretty clear that machine learning, and maybe KNN in particular here, Could be a really robust tool for predicting diabetes risk.
I think so. It's a significant step forward in potentially identifying and managing this condition proactively. And this kind of research contributes directly to that global search for better management and prevention, especially since, we still don't have a direct cure. But it does raise an important question. How do we take these powerful tools and actually scale them up, make them widely available?
Yeah, how do we move from reactive care to something more like proactive wellness using this tech?
Mm.
But we also need to be a bit cautious, right? I mean, you mentioned the data set was from the U.S., and they only looked at 3 algorithms. How universal are these findings?
That's a really crucial point. Absolutely. While it's incredibly promising, this study, like any research, has limitations. The US-centric dataset means it might not perfectly reflect the global picture. And only testing 3 algorithms means there could be other, maybe even better, approaches out there.
Right. So it definitely highlights the need for more research, maybe research using, I don't know, real-life patient monitoring data from wearables.
Exactly. Or exploring more advanced deep learning techniques. The goal is to create solutions that are truly universal, robust, and reliable for everyone.
Imagine that future, though. AI helping us predict and maybe even prevent diabetes before it really takes hold. Everywhere. That's the potential we're looking at.